In this video we will learn about psychosis. Visualize yourself out with friends. You are at your favorite restaurant waiting to be served. Suddenly you notice people are watching you. You begin to hear people whisper your name. You know they're about to do something. Your friends don't notice that you're all about to be harmed. You mentioned what's happening to your friends and they're confused. You have to make them understand quickly before something bad happens. If you experience something like this, it could be psychosis. What is psychosis? Psychosis is a mental disorder characterized by disconnection from reality. India records more than 1 million psychosis cases per year. Possible symptoms include delusions, hallucinations, talking incoherently, agitation, nightmares, hyperactivity, suicidal tendencies, hearing voices, and depression. The person with the condition usually isn't aware of his or her behavior. Someone with psychosis experiences the world differently than other people. Sometimes they might have thoughts about themselves or the world that are not true or that no one else believes. These kinds of thoughts are called delusions. Other people might have hallucinations, where they see, hear, taste, smell, or feel things that aren't actually there. These are complex mental health symptoms and can happen for several reasons. Sometimes a person can experience psychosis because of a medical condition, like a very high fever. Some people have psychosis after using lots of drugs or alcohol, or if they have a severe substance withdrawal. Psychosis is also a symptom of some specific mental health conditions, like schizophrenia, which is a disorder. The good news is that there are medications that can treat psychosis. Treatments for psychosis: supportive care, hospitalization, a higher level of care whereby patients are closely monitored and may be given medications that would not be available at home. Medication: antipsychotic drugs reduces or improves the symptoms of certain psychiatric conditions. Therapies: cognitive behavioral therapy is a talk therapy focused on modifying negative thoughts, behaviors and emotional responses associated with psychological distress. Psychoeducation is education about mental health that also serves to support, validate and empower patients. Family therapy is psychological counseling that helps families resolve conflicts and communicate more effectively. Every person's experience with psychosis is unique. Unfortunately, psychosis is a word that can be misunderstood. A common misconception is that people with psychosis are dangerous or crazy. People experiencing psychosis are more likely to be withdrawn, confused or frightened than violent. Another myth is that psychosis will not get better. Symptoms of psychosis can be managed through support, therapy and by taking medications. People who have experienced psychosis can also lead a healthy, productive life. Recovery from psychosis is achievable through early intervention. Studies have found that the earlier someone gets help with psychosis, the better their outcomes will be. If you or someone you know may be experiencing psychosis, contact a mental health professional to start on the path to recovery as soon as possible.